So following on from my last part of my story, I think we're just going to have to feck off abroad again for help. 4 years is absolutely ridiculous to be waiting for pain management. I saw pain management privately a couple of years ago, and they tried some very expensive kind of procedures that had no guarantee of working, but we tried it out. It didn't work for me, and I couldn't afford again to be paying €1,500 for pain management. So instead of the UK this time, we're going to look at going to Italy, because there's a geneticist there that we need to go and see for a huge cost of €45. Like, to see a consultant here is anywhere between €150 and €350 privately, and it's €45 in Italy. So we're going to find out how much they're going to charge for genetic testing as well, because we've been told by Olivia's paediatrician some time ago that she needed genetic testing, but it was going to cost us £2,000 just for the test, never mind the travelling and everything. So we're going to see how much the testing is, and while we're there, I'll see if I can see somebody for pain management while I'm at it, because no one should be expected to take 4 years. 4 years of unmanaged pain. I'm maxed out on my tramadol, and even though I shouldn't, there are days where I take a little bit more. On the occasions where to the point where my mental health is severely affected. So yeah, Italy is looking like that's what we're going to do, unless in the meantime we get word, but my GP isn't confident that I'm going to be seen before the end of the year. And I was also referred to the wrong pain consultant. I had asked to see one specific who I'd seen privately and who knew about EDS, but she referred me to someone else. So
hi, I'm Catherine Colbert of the EDS for IRE campaign, Dundalk for Change, and the Cripple Baby blog. I asked Evie from the Zebra Mom blog, Social Democrats, and of course the EDS for IRE campaign if I could share her recent Instagram story with you today. As you can see, it's raw and she's fed up and very hurt. I've been in that situation where I'm tired of this country also and just feel rejected. I'm currently in that situation, so many of us are. When I've mentioned to people before online that some of us are on these waiting lists for up to 4 years, that I've waited up to 4 years in some instances, and that I've been called a liar. We realise that waiting lists for pain clinics and other consultants don't just affect those with Ehlers-Danlos syndrome and hypermobility spectrum disorder. We aren't asking for any kind of special treatment. And we also understand that OT and physiotherapists are in very short supply, and that availability in this country is kind of a postcode lottery. But we would like if more of the public OTs and physiotherapists that were available, that were kind of hypermobility aware. On top of this, we already have to travel to the UK and other parts of the world for basic healthcare as it is. Evie and her children are included in that, of course. Healthcare that is not available here. EDS consultants and the upright MRI machine in London, to name the two main reasons to travel, really. The fact that she now has to travel abroad and pay out of her own pocket for healthcare service that is available here is the biggest insult to us all, really. It's an even bigger slap in the face. I felt personally attacked watching her Instagram video, and I know a lot of people with EDS and HSE would have watched her video on Instagram and felt the same way. We feel so rejected and let down by our government and healthcare system here in Ireland. I sometimes feel like I have no nationality, no country, no citizenship. I know that sounds dramatic, but that comes from years of being told, I'm sorry, there's nothing I can do for you. That comes from years of feeling let down and rejected. And don't get me wrong, I don't blame the doctors and nurses in the slightest. I have met some lovely ones throughout the years and who wanted to help me more than anything, who were genuinely upset by the fact they couldn't, but they were working in an impossible system. At the same time, I have met some medical professionals whose ego would not allow them to even believe in the existence of EDS or HSD. I'm even lucky enough to have a brilliant pain consultant, but it came after 4 years of waiting, and I realise I'm extremely lucky to even have that here in Ireland and to not have to pay for it. Something else I would like you to all have note from Evie's very passionate and unedited video is that she, like so many parents of EDS and HSD patients, puts her children's health first. As you can hear from her video, that she is booking her child's appointment over hers, and so many parents have had to decide that here in the country, that she can only afford to take care of one first. So meaning there are loads of parents here who don't even have their diagnosis because they have had to pay for their children's healthcare in foreign countries and can't pay for their own. These are genetic conditions after all. Whole families are suffering. My daughter is 3 months old this week, and instead of planning for my first family holiday with her, I'm planning my next medical trip to London in the middle of a pandemic. If by some miracle the health minister, the Taoiseach, is watching this, then I beg you to please help us. We can't keep doing this. Another generation of Ehlers-Danlos syndrome and hypermobility spectrum disorder patients can't keep suffering like this. We need a qualified rheumatologist on the public list, at least one. We need rheumatologists to feel fully trained in connective tissue disorders so they feel confident in diagnosing us. They need to know the actual terminology. You insist they are, and they do. I can tell you this is not the case. The hypermobility section on the HSE website is very outdated, which really says it all. We need an upright MRI machine. It's vital for our health. Please help us. To everyone else, please go to the website edsforire.ie, sign the petition, sign the latest TD letter, see the section on how to get involved, and look around the website. Follow us on social media, subscribe on the YouTube channel, and please share this video far and wide. Thank you.